Hi, my name is Andrew Flynn. I'm a family medicine doctor in Durham. This educational video about COVID-19 is for large groups of people staying together. Many common colds and flu-like illnesses are caused by viruses. The new coronavirus that causes the disease called COVID-19 is a virus that can cause cold symptoms like runny nose, sore throat, cough, but can also cause more serious lung disease in some people. Some people who get this virus feel well and don't have any symptoms, and some people have mild symptoms like a sore throat and runny nose. Some people have severe symptoms like fever and trouble breathing. Sometimes people need to go to the hospital, and some people even die from this virus. The virus tends to cause more problems in elderly people and people with other diseases such as lung disease, heart disease, diabetes. But it's possible for anybody to become infected, to need hospitalization, and even to die, including young and healthy people. There's no vaccine and no cure right now, so the most important thing we can do is prevent ourselves from getting it and to prevent spread to others. Because some people may get the virus and not have symptoms, and others might have mild symptoms, it's hard to know who has it and who does not. Many people might have the virus and not know they have it and can spread it to others if not careful. Many people who have contracted the virus got it from friends, neighbors, and coworkers who didn't have symptoms or who got symptoms later. This is why it's important for everyone to follow the instructions all of the time to protect themselves and others. You can get the virus from anyone, and people living in close proximity to others are at the highest risk of the virus spreading quickly. One of the most important things we can do to prevent the virus from spreading is wearing a mask when you're around others. Your mask can be a surgical mask, like this one, or it can be made from something else, like a bandana. The most important thing is that your nose and your mouth are covered, otherwise it doesn't work. To protect yourself, it's important to wear your own mask and to make sure the people you're around are also wearing a mask. If someone around you is not wearing a mask, then you are at risk of being exposed. We all need to be in our best state of health so our immune systems can protect us. This means we need to be taking good care of ourselves, staying hydrated, eating healthy, getting enough rest, and cutting back on things that hurt our immune system, like alcohol, tobacco, and other drugs. One of the most important things you can do is wash your hands with soap and water for at least 20 seconds, or use an alcohol-based hand sanitizer. Wash your hands when you come home, before you eat, and in between other tasks. Avoid wearing jewelry like watches when you go to the doctor, when you go to work, or when you go to the store, as they can hold on to germs even after you wash your hands. Clean surfaces that people touch often with disinfectants like alcohol wipes or rags with soap. This includes doorknobs, light switches, toilet handles, sinks, microwave buttons, fridge handles, computers, keys, phones, and other things that you carry with you. Standing in lines is when there's a high risk of the virus spreading. When standing in lines, make sure that you stand at least 6 feet away from everyone on all sides. Wear your mask and don't take it off while you're standing in line. Stay away from other people who are not wearing a mask. If you need to cough or sneeze, cough into your elbow, not into your hands. And make sure that you wash your hands when you get back to your room. Taking breaks to go outside and walk or sit in the sun is important for your health. Here's how you can keep yourself safe. Stay 6 feet away from people on all sides. Wear your mask and make sure the people around you are wearing their mask too, covering their nose and their mouth. This is especially important if you or others are removing your mask to smoke. Make sure that you put it back when you get close to anyone else. Avoid sharing lighters, cigarettes, or other personal items to avoid spreading the virus. If you can, change your clothes when you get home. You can leave your clothes in a special bag by the door. Also, leave your shoes at the door. If you're doing other residents' laundry or handling others' belongings, remember to wear your gloves and your mask. Avoid touching your face or your items when you're handling other people's laundry. After you're finished, make sure that you remove your gloves and wash your hands before you touch your face, remove your mask, or touch your items. If you feel sick, for instance, if you have a fever, a new cough, trouble breathing, sore throat, runny nose, or a loss of your sense of smell, tell a staff member. The people you stay with will be grateful to you for speaking up so we can make sure the virus doesn't spread. Stay in your room and work with the staff to make sure that others are not exposed and figure out the next steps to get tested or to quarantine. If you're told to quarantine for several days or to go to the doctor for a test, please do it. This is how we stop others from getting sick. You might even save somebody's life. If you're a staff member or other worker and you interact with clients or you clean common areas, make sure you remember to keep at least 6 feet between you and the clients at all times. Make sure that you wear your mask. And if you're touching other people's personal items or passing items to clients, make sure you also wear your gloves. Don't touch your face or your personal items when you're wearing the gloves. Wipe down areas that are commonly touched, and when you're finished, make sure that you wash your hands before you touch your own face or your own items. If you need to check on a client who may be ill, try minimizing the time you spend face-to-face by calling them on the telephone to have your conversation. If you have to speak in person or bring them something, make sure that you and the client are wearing a mask. Anyone having physical contact with someone who's ill or their personal belongings, such as clothes, should wear a gown and gloves and have a proper way to dispose them. Thank you for watching. If you have questions, ask your staff or your supervisor and we can get you answers. If we all work together, we can keep ourselves and those around us safe. Thank you also to Dr. Garcia Sampson and to Valerie Haywood for helping to develop this material.